recently had some genetic testing, or sequencing testing done rather, and it revealed some interesting genes that may pose an increased risk for lymphedema. And the big one was being factor V, which makes me more prone to clotting. So I'm curious if you've had any genetic studies done and if they revealed anything that could be related to compounding issues that would cause more concerns for you, like surgery or travel. Anything that shows up for you?
So I had genetic testing when I was 11, when I was initially diagnosed. That was part of it because, again, I went to so many different physicians and nobody
Right.
could give it a clear diagnosis. So that led us to go to a specialty clinic where they did get a geneticist involved. And that's where they identified primary lymphedema, right? And
Okay.
we're just now in the medical community, and I say just now, like within the past 5-6 years or so, are doing things with lymphatic imaging, for example, where you can identify stage 0 lymphedema. So when a patient is asymptomatic, no signs of swelling, pitting edema, nothing, but you can still see if there's impaired lymph nodes or lymph vessels, right? So one thing that was really fascinating for me is I didn't have any memories of my parents, which they're both still alive, or my grandparents, those which they're all deceased, having swollen limbs or anything like that. But I did always remember my grandmothers on both sides always having kind of varicose veins or spider veins. One was larger in size and one, she was kind of tall and thin Dutch woman. But what we know now about the relation between the vascular system and the lymphatic system is that essentially if a patient's parents had some sort of venous disease like spider veins, varicose veins, any venous insufficiency, that patient is substantially more likely to get lymphedema, right? It's a genetic predisposition. So we all have different triggering events. Like for me, it was my first surgery on my knee. Other patients, it could be as simple as a bug bite or just bumping their arm or leg in whatever way that their body didn't agree to, but they were basically already genetically predisposed to getting lymphedema. So I think it's fascinating. We're starting to understand that more. And hopefully the diagnosing is much larger and earlier on, right? Early detection for any type of illness is always going to be the key, whether it's cancer, lymphedema, diabetes, whatever. So I think that's the trajectory we're getting on. And I feel optimistic about that.
Right? So living in the US, you have so many amazing medical facilities that are doing great work in the lymphedema field. What state do you think offers some of the best options for people who are living with this sometimes debilitating disease or illness?
So with lymphedema and lipedema, because there are so many different types of treatments available, from having really highly qualified certified lymphedema therapists who are also wound care experts, to having vascular surgeons and super microsurgeons who are doing lymphovenous bypass surgeries, lymph node transfer surgeries. So it is kind of bits and pieces here and there. But I'd say in the United States, in terms of the research piece, you see a lot coming from Northern California. So out of Stanford University, Dr. Stanley Roxon, he's one of the big thought leaders in terms of not just the advocacy with Learn, but the research and the case studies going into finding cures for lymphatic diseases. Also on the East Coast, so in the Boston area, Boston Children's Hospital has an amazing vascular anomalies clinic where they have a lot of specialties in lymphatic malformations for pediatrics, which to me is my biggest passion, is helping the kids early and often. And then where I'm actually going to be going next week, I'm heading to the Cleveland Clinic in Ohio to receive my lymphovenous bypass surgery by Dr. Wei Chen, who's been featured in Learn and is one of the super microsurgeons who does a lot of different types of lymphatic surgeries for patients. And then where I live in Houston, Texas, where Houston, Texas has the largest medical center in the United States. So there's a ton of oncologists, lymphedema therapists there. So very blessed to have this medical community in my backyard and get to serve their patients.
Okay, that's great. Are you nervous or excited, or both?
I think anytime you go under, there's a little bit of nerves there because, what if I don't wake up? Or I think any patient does the whole risk reward analysis. Is my current state the risk of getting worse? Does that outweigh where I'm currently at, and it's not tolerable. And I think I've done a great job really the past 3 years, even more so the past 2 years, of being really compliant and religious with all my compression modalities. So I feel like I have most of the symptoms under control. But for me, I wanted to get this surgery now because with the lymphovenous bypass surgery, there's no risk in establishing lymphedema in an unaffected limb. Because if you do a lymph node transfer, so you're harvesting a healthy lymph node
Right.
from an unaffected limb, arm, leg, inguinal nodes, wherever they're harvesting them from, if the surgery's not done properly, and just in general, the transfer capacity of that fluid in the long run, you could be prone to establishing lymphedema in those limbs. And I'm not trying to scare any patients away from doing that, because they have had a lot of successful cases too.
Right.
But for me, I even wasn't a candidate for the lymph node transfer, because my lymph nodes are totally healthy and fine. It's my lymph vessels that are compromised. So that's why I'm getting the lymphovenous bypass surgery anyway. And it either works and my swelling goes down and overall health improves, or it doesn't, and I'm still the same where I'm at now. There's no risk of regression.
So you had the chance to meet with and mentor with one of my most favorite advocates, Kathy Bates, a lovely actress. And what was the best piece of advice that she gave you since you met?
So I say this all the time because it still sticks with me every day. The first time I met Kathy, we were at the American Society of Breast Surgeon conference in Dallas. And that was kind of my first appearance as a Learn ambassador. And I had no idea that Kathy was going to be there. So Bill, who's the CEO of Learn, didn't tell me that. He just said, I have someone I want you to meet. And I had no idea like why I would be going to a breast surgeons conference, because I've never had breast cancer. I have no desire to get any augmentations, if you will. And so, but I figured there would be some sort of lymphedema connection, obviously, because Learn wanted me there. So it was really a pleasant surprise, because Kathy Bates gave the keynote speech. And in her introduction, she actually told a really abridged version of my story with my lymphedema and how I almost lost my leg. And here it is, an Academy Award winning actress who I've never even met before already knows my story and is telling it to an auditorium of over 3,500 renowned cancer surgeons, right? And so later that evening, she invited me to have dinner with her and Bill. And the thing that she told me that has made the biggest impact in my life is, she said, Cam, the lymphedema community needs you, and your pain is your strength. And I just remember thinking, like, back to the days when I was 11, had my first major knee surgery, and I'm recovering in the recovery room, and I'm just screaming in excruciating pain. I have the morphine drip and it's not working, but having experienced that pain at such a young age really has given me not just a high pain threshold, but an appreciation for life, and taking that pain and turning it into an opportunity to help others who are way worse off than I am.
Okay. Yes, I'm sure it must have been a bit of a surprise.
Yeah. Yep. I'm like, please don't take a club to my knee, like her misery.
Misery, yes.
Yep.
She wasn't carrying a hammer or a sledgehammer, right?
No sledgehammer.
So you mentioned being on The Bachelor a minute ago, and the Bachelor franchise. So you not a celebrity in your own mind, but some people think of you as a celebrity. And I'm just wondering, now that you're out and proud about your status as a lymphie, do you find that dating is now easier for you as far as outing yourself as someone with lymphedema, because more people know, or it's just more people maybe know about it because of you, in fact? Has it made it easier for you when you date?
I think just life in general post-show is very different, because you go from just being a regular average person, which I still am, but like when you get that sort of exposure and the distribution, if you will, I like to call it, that's when people you don't know recognize you. And when you're on a reality television show, you don't have complete control over the edit or how you're perceived, right? So for me, I didn't personally like the way in which I came off on either of the two shows that I was on. So I always kind of felt more like I was in this constant PR mode to be overly kind to strangers that I met. But I don't really feel that lymphedema has impeded my ability to date. I just think right now, because I just moved back to Houston, I was in Austin for several years, that I'm really taking my career seriously, and I'm establishing myself in that regard. And I feel that when the right person comes along, it'll be a organic, natural, easy conversation. I kind of feel like I'll end up with somebody who's in the healthcare, whether it's a nurse, doctor, therapist, someone that I can have kind of clinical conversations and kind of geek out about, but then, you know, someone who's going to accept me and know that when you're dealing with any type of chronic illness, there are long-term implications that I don't know if I'm going to have another infection 2 weeks or 2 years, 20 years down the road. I don't know how bad my swelling could progress. So I think having somebody be aware of that relatively early on, as opposed to it being kind of a surprise, is something that I'm obviously going to have to keep in mind. And I think I was telling Dee in a previous conversation, if I'm going on a first date, I don't think I'm going to lead with, oh, hey, I have lymphedema, right? Because, you know, that's not all of me. It's part of me.
Right.
But I think when the conversation's organic and they ask, oh, well, what do you do for a living? Then with what I do, it's obviously going to come out sooner than
Right.
what it would have
Yeah.
2 years ago when I was in advertising, right? So again, I think I've really embraced it, and it's an unavoidable conversation for me in my personal life and obviously in my professional life now.
My next question for you is a bit of a fun one. I was listening to the Lymphedema podcast, the tail end of one of your interviews around dating and with lymphedema, and you mentioned that you like to look for recipes. I'm like, fellow cook, somebody likes to look for recipes. Let me ask this question. It's about cooking, totally different topic.
Okay. Okay.
So, what is your absolutely favorite dish to cook?
Okay.
And what would your friends and the people who are lucky enough to eat food from you say is the thing that you're absolutely ace at making?
Okay. Yep. It's easy. So I'm like grill master. I wouldn't say like I'm really good at the barbecue thing, like with the brisket and stuff, but I can take a chicken breast and I have a concoction that I marinate it and season it with, and I will grill that, and I will grill zucchini squash. And my ace, the one thing that just gets 5-star ratings every time, is my asparagus, my steamed asparagus.
Nice.
The way that I season that. So
Okay.
you have, you know, the asparagus, the zucchini squash, and my sensationally marinated and seasoned chicken breast. That's my go-to. But earlier this week, I used a crock pot and utilized one of my friend's recipes for a Tex-Mex style chicken tortilla soup, which that's one that like gets better 2 or 3 days after.
Yes.
You just keep reheating it. It's so good. Yeah.
Yum. You might have to
love the
share those
compliment.
recipes.
Yes,